Hello neighbors, it's so wonderful to see all of you today. We have something very special to talk about, something that can make a huge difference in our community. Today we're going to talk about something very important, CPR. CPR stands for cardiopulmonary resuscitation. It's a life-saving technique that everyone should know. Whether you're young or old, learning CPR can empower you to help in emergency situations. CPR stands for cardiopulmonary resuscitation. This technique is used when someone's heart has stopped beating, and it can be the difference between life and death. By performing CPR, you can keep blood flowing to the brain and other vital organs until professional help arrives. It's a way to help someone whose heart has stopped beating. When you perform chest compressions, you are manually pumping the heart, helping to circulate blood and oxygen throughout the body. This can buy precious time and increase the chances of survival. Just like we learned how to tie our shoes, learning CPR is a skill that can help others. It might seem a bit daunting at first, but with practice, it becomes second nature. Think about how many times you've tied your shoes without even thinking about it. CPR can become just as automatic. It's like having a superpower that can make a real difference in someone's life. Imagine being able to step in and save a life, just like a superhero swooping in to save the day. It's an incredible feeling to know that you have the power to help someone in their most critical moment. Imagine you're at the park, and someone suddenly collapses. It could be a friend, a family member, or even a stranger. In that moment, knowing CPR means you can take immediate action. You won't have to stand by helplessly. Instead, you can be the person who steps up and makes a difference. Knowing CPR means you can jump into action and help. You'll know exactly what to do, from checking for responsiveness to performing chest compressions. Your quick response can keep the person stable until emergency services arrive, greatly improving their chances of recovery. You become a link in the chain of survival, giving that person a chance to be okay. The chain of survival includes early recognition, early CPR, rapid defibrillation, effective advanced care, and integrated post-cardiac arrest care. By learning CPR, you are an essential part of this chain, providing the crucial early intervention that can save lives. It's normal to feel a little nervous about learning CPR, but remember, every hero starts somewhere. Let's learn together. We'll go through the steps one by one, and with practice, you'll gain the confidence you need. Remember, the more you practice, the more prepared you'll be to help someone in need. So let's get started and become the heroes our community needs. Imagine our body is like a house. When someone's heart stops, it's like the lights have gone out. First, we need to see if anyone's home. Gently tap the person on the shoulder and shout their name. Can you hear me? If they don't respond, it means they need our help. It's important to remember to stay calm. We want to help our friend, and staying calm helps us think clearly. Now that we know our friend needs help, let's move to the next step. Next, we need to see if our friend is breathing. This is a crucial step in ensuring their safety and well-being. When someone is unconscious, their breathing can be shallow or irregular, and it's our job to determine if they need immediate help. Think of it like checking if there's a gentle breeze coming from their nose and mouth. Place your ear close to their face and feel for any air movement. This can be a subtle sensation, so take your time and be patient. Look closely at their chest to see if it's moving up and down. The rise and fall of the chest is a clear indicator of breathing. Sometimes clothing can obscure this movement, so gently adjust their clothing if necessary to get a better view. Listen carefully for any sounds of breathing. This might include soft breaths, wheezing, or even slight gasps. Each sound can tell you something about their condition. Feel for any breath against your cheek. This method is particularly useful in noisy environments where listening might be challenging. The warmth of their breath can be a reassuring sign that they are still breathing. Sometimes it can be hard to tell if someone is breathing. Don't be discouraged if you're unsure. It's better to be cautious and take your time to make an accurate assessment. That's okay. If you're not sure, it's always best to act as if they're not breathing and move on to the next step. This ensures that you are providing the necessary care without delay. Remember, every second counts in an emergency situation. Remember, we're doing great, let's keep going. Your calm and composed actions can make a significant difference. Stay focused, stay positive, and continue to follow the steps. You're doing an amazing job, and your efforts are truly commendable. Now it's time to help our friend's heart beat again. When someone's heart stops beating, every second counts. Immediate action can make the difference between life and death. One of the most effective ways to help is by performing chest compressions. This technique helps to manually pump blood through the heart and to the rest of the body, keeping vital organs supplied with oxygen until professional help arrives. We do this with chest compressions. Chest compressions are a critical component of cardiopulmonary resuscitation, or CPR. They are designed to mimic the heart's natural pumping action, ensuring that blood continues to circulate. This can be crucial in maintaining brain function and overall circulation. First, imagine a line between the nipples on their chest. This line will help you find the correct hand placement for effective compressions. Proper hand placement is essential to maximize the efficiency of each compression and to minimize the risk of injury to the person you are helping. Place the heel of one hand right on that line. The heel of your hand should be positioned at the center of the chest, on the lower half of the breastbone. This is the optimal spot to apply pressure and ensure that the compressions are effective. Then, put your other hand on top of the first hand, interlocking your fingers. Interlocking your fingers helps to keep your hands in place and allows you to apply more force with each compression. This technique also helps to distribute the pressure evenly across the chest. Keep your arms straight and your shoulders directly above your hands. This posture is crucial for delivering effective compressions. By keeping your arms straight and using your body weight, you can apply the necessary force without tiring quickly. This ensures that you can maintain the compressions for as long as needed. Push down hard and fast on the chest, about 2 inches deep, at a rate of 100 to 120 compressions per minute. The depth and speed of the compressions are important. Pushing down about 2 inches ensures that you are compressing the heart effectively, while the rate of 100 to 120 compressions per minute mimics the natural heartbeat. You can think of the beat of the song "Stayin' Alive" to help you keep the right rhythm. This song has a tempo of around 100 beats per minute, which is within the ideal range for chest compressions. Keeping this rhythm in mind can help you maintain the correct pace and ensure that your compressions are as effective as possible. Remember, your actions can save a life, so stay focused and keep going until help arrives. Section 5, Rescue Breaths, Sharing the Breath of Life. If you've been trained in CPR and feel comfortable, you can give rescue breaths after every 30 chest compressions. Tilt the person's head back gently by lifting their chin. Pinch their nose closed and seal your mouth over theirs. Give 2 breaths, each lasting about 1 second. Remember, rescue breaths are important, but only if you've been trained. If you haven't, focus on giving high-quality chest compressions. Section 6. You are a hero. Keep going. Keep giving chest compressions and rescue breaths if trained until help arrives. Don't stop until someone else can take over. You are doing a wonderful job. You are a hero for helping your friend in need. Your actions are giving them the best chance of survival. Remember, even if you're tired, keep going. Every compression, every breath is making a difference. Section 7. CPR, a skill for life. Learning CPR is like learning to ride a bike. It's a skill you never forget and can use to help others throughout your life. You never know when you might need to use CPR. It could be a family member, a friend, or even a stranger on the street. By learning CPR, you're becoming a valuable part of our community, a helper, a friend in need. And that's a truly wonderful thing. Section 8. Practice makes perfect learning CPR. The best way to learn CPR is to take a class from a qualified instructor. They can teach you the proper techniques and answer any questions you have. There are many organizations that offer CPR classes, such as the American Heart Association and the American Red Cross. Learning CPR is a fun and rewarding experience. It's a chance to meet new people, learn new skills, and make a real difference in the world. Section 9. Remember, you're making a difference. Learning CPR is a wonderful gift you can give yourself and your community. It's a powerful tool that can help save lives. Remember, you are capable, you are strong, and you can make a difference. Thank you for being a caring neighbor and learning about CPR. Keep up the great work.